Alright, so now I'll go ahead and assess my patient's cranial nerves while I'm assessing the head, face, and neck. And I can assess cranial nerves 5, 7, and 11. And I can assess cranial nerve 5 by using something like a cotton ball or like a sharp utensil or something like a paper clip. So I'll just use like the end of this pen cap, and I can assess this cranial nerve 5 by kind of just brushing this along my patient's cheek or anything and have them feel for that sensation. And if the patient is able to tell me that this is sharp or a soft sensation, this states that their cranial nerve 5 is intact. After that, I can go ahead and assess cranial nerve 7. So with assessing cranial nerve 7, I can give my patient like a piece of candy or something. So I'll go ahead and give them a piece of candy, and I'll have them to differentiate if the candy is sweet or sour. So if my patient is able to do that, I'll give him the candy. He states that the candy is sour. So that states that he has his sensation in cranial nerve 7 for taste. And I will state that his cranial nerve 7 is intact. To assess cranial nerve 11, I'll have my patient either shrug their shoulders up and down. I'll have him turn his head, rotate his head. So my patient is able to turn his head, shrug his shoulders, move his head up and down. So this states that cranial nerve 11 is intact, and he has no abnormal findings with those 3 cranial nerves, with cranial nerve 5, 7, and 11. Next, I will move on to my patient's eyes. So I have my pen light here. So to start off, I'm just going to start by inspecting the external ocular of my patient's eyes. So I'm looking at my patient's eyes, and as I'm inspecting, I don't see any signs of redness or discharge. So I will state that there are no abnormal findings with inspecting my patient's external ocular. After that, I have my pen light. So I can assess for my patient's pupils, but before I do that, I will go ahead and also inspect my patient's conjunctiva and sclera. So as I'm looking into my patient's eyes, I'm noting that my patient's conjunctiva and sclera is white and moist, and it's pink and moist. And, there are no signs of wounds or lesions within their eyes. So then next, that's when I would go ahead and use my pen light, and I would assess my patient's pupils. And I'm assessing for Perla. I'm assessing that my patient's pupils are equal, round, and reactive to light. So with that, I can just take my pen light and I'll go ahead and shine it into my patient's eyes, and I can see that their pupils do react to the light. So as I am moving the light towards their pupils, my patient's pupils are going to constrict, and as I'm moving it away, it's going to dilate. So this states that their pupils are reactive, they're round, they're reactive to light, and they're equal. So this states that my patient has no abnormal findings within their pupils, and the Perla is intact. After that, I can go ahead and assess cranial nerve 3, 4, and 6 with just using my pen light, and I can have them assessing cranial nerve 3, 4, and 6. I would use the 6 cardinal gaze test, and I would just have my patient just kind of follow the pen light just with their eyes without moving their head. So I'll just move it in different directions, kind of like this. And as they're following it with their eyes, this notes and states that their cranial nerves 3, 4, and 6 are intact because they're able to have normal eye movement without moving their head, and they're able to look in different directions. Another way that I can also assess accommodation in my patient, I can have them look at something far back in the room, like a clock or a sign or something, and I can have them read that back to me. After that, I'll go ahead and inspect my patient's ears. So I'm looking at my patient's ears. I'm looking on the outside, the external part of their ears, and I don't see any signs of redness or discharge coming from my patient's ears. I can go ahead and assess cranial nerve 8. And assessing cranial nerve 8, I will go ahead and do the whisper test. So I have my patient, and I can stand from behind my patient, and I'll go ahead and whisper a phrase. Okay, so I have whispered a phrase into my patient's ear, and my patient restated the phrase. He stated that I whispered bluebell. So this states that my patient's cranial nerve 8 is intact, and he had no abnormal findings with that, and he was able to state what I said during the whisper test. After that, I will go ahead and inspect assess my patient's nose. So I'm looking at my patient's nose. I'm looking at the outside of my patient's nose. I don't see any signs of discharge or swelling or edema. It looks like my patient's nose is symmetric to their face, and there's no signs of inflammation. I can also check in my patient's nose for bilateral patency, and by that I will use my pen light. And basically I'll just kind of shine the pen light up their nares, and I should see a red transillumination in their nares, and that states that they have bilateral patencies within their nares and that there are no abnormal findings with that assessment. So I've assessed my patient's nose, no signs of discharge or inflammation. The nose is symmetric to the face, no signs of deformities, and my patient has bilateral patency is intact. It is normal. After that, I will go ahead and assess my patient's mouth and throat. So I'm going to inspect my patient's lips, tongue, and his gums. So I'm just inspecting and looking, and I can see that my patient's lips, tongues, and gums, they are pink and moist. There are no signs of lesions or wounds within inside their mouth or their gums. Their tongue has no signs of swelling or inflammation. They have the correct color, such as his lips should be pink, his gums should be pink, his tongue should be pink, and it all should be moist. After that, I can go ahead and assess cranial nerve 9 and 10. And cranial nerve 9 and 10 is assessing my patient's gag reflex and their speech. So I can have my patient just say a phrase to me, and I can assess that their speech is clear. I can assess their gag reflex by taking a tongue depressor and having my patient open their mouth and stick their tongue out and saying ah, and I can just stick the tongue depressor to the back of his tongue, and that will assess his gag reflex if he's able to gag on that, and that will assess that my patient's cranial nerve 9 and 10 is intact and there are no abnormal findings with that. I can also assess my patient's cranial nerve 12 by having my patient move their tongue in a different direction to state that they have good range of motion within their tongue. So I can have my patient like move their tongue side to side. So my patient was able to move his tongue side to side. He's able to move his tongue up and down. So this shows that my patient's cranial nerve 12 is intact. Next, I will move on to assessing my patient's respiratory system. So that is where my stethoscope will come in place. So first off, I will inspect my patient's anterior chest. And as I'm looking at my patient's anterior chest, I don't see any signs of use of accessory muscles. My patient is not in any signs of acute distress. So I'll go ahead and move forward and listen to my patient's lung sounds. So when I'm listening to my patient's lung sounds, I'm listening with the diaphragm on my stethoscope, and I'm going to listen on the anterior side and the posterior side, and I'm listening with the diaphragm. All right, so I go ahead and listen to the anterior side, and with the anterior side, I'm listening for 4 to 6 spaces, and on the posterior side, I'm listening to 6 to 8 spaces. So I will just name the spaces that I'm listening in. So we have on this side, we have right upper lobe, left upper lobe, right lower lobe, and we have the left lower lobe. So these are my 4 spaces on the anterior side. So I have the right upper lobe, left upper lobe, and then we have the right lower lobe and the left lower lobe. And then we have the posterior side. So on the posterior side, I'm listening for 6 to 8 spaces. So then on this side, we'll start with the left because this is the side that I am on. So we have the left upper lobe, right upper lobe, right upper lobe, left lower lobe, and then you have the right lower lobe and the right lower lobe. So we have 2 spaces in each lobes on the posterior side that you're listening to. And as I was auscultating and listening to my patient's lung sounds, I don't find any abnormal sounds, any abnormal findings as I'm listening to those lung sounds. Like I said, my patient doesn't have any signs of acute distress. So next I will go ahead and inspect the cardiovascular system. So for that, I will go ahead and palpate my patient's carotid post. So for the carotid post, I'm feeling on the my patient's neck, and I'm just gonna feel for the carotid post. And you want to do that simultaneously. You don't want to do that together because that can cause the patient to pass out. So I'm feeling for the carotid post on each side of my patient's neck, and as I'm feeling from my patient's post, the post has a good rate, rhythm, and force. All right. So next, I will go ahead and inspect for my patient having a JVD. So what I will do, I will have my patient lay at a 45-degree angle, and I will have them turn their head to the left side, and I will stand on their right side to assess for any distension within this vein on the side of their neck. So as my patient is laying at a 45-degree angle with his head positioned to the left side, I'm looking and I don't see any signs of JVD, which means when they're sitting up at a 45-degree angle, there should be no signs of distension of that vein. So there are no signs of JVD without my patient. Next, I will go ahead and assess for any signs of edema. I don't see any signs of edema within my patients, within their legs or arms. So I will state that there are no abnormal findings with that. Next, I will go ahead and listen to my patient's carotid arteries. So first, I will start off by listening with the diaphragm, and then I will listen with the bell. So I'll go ahead and listen with the diaphragm first, and I'm just going to place where I'm listening. So we have aortic, pulmonic, aortic, pulmonic, Erb's point, tricuspid, and mitral. So that was on the diaphragm side. Now I'll listen to on the bell. So we have aortic, tricuspid, Erb's point, aortic, pulmonic, Erb's point, tricuspid, and mitral. So I have listened to my patient's carotid pulses with the diaphragm and the bell side of the stethoscope, and there are no abnormal findings with those sounds. So next, I will go ahead and move on to palpating my patient's radial pulses. So I will palpate my patient's radial pulses on both sides of their hands. So I'll go ahead and feel for the radial side, which will be on where the thumb side. So I'll go ahead and feel for those pulses. So I'm feeling for my radial pulse on the right hand, and I'm feeling for the radial pulse on the left hand. And as I'm feeling for my patient's pulses, they have a good rate, rhythm, and force. All right. So next, I will go ahead and move on to palpating my patient's pedial pulses. So for the pedial pulses, I'm going to palpate my patient's dorsalis pedis post on the right and left foot, and the posterior tibialis post. So when I am assessing for my patient's dorsalis pedis post, it will be placed on the anterior side of their foot. It'll be at the top, and I can kind of show you on mine. And what I'll do, I'll place my finger kind of slightly. I'll place my finger you can feel for the post. Like they say, this is the big toe, so it's between the big toe and the second toe. So I'll feel for a post there, and that's how you feel for the dorsalis pedis. So on the top of the foot. And then I will feel on the left foot. And as I'm feeling for those posts, the dorsalis pedis posts, they have a good rate, force, and rhythm. There are no signs of the posts being unlabored or diminished. So I felt for my patient's dorsalis pedis posts on the right and left. Next, I will go ahead and feel for my patient's posterior tibialis. So with that, you are feeling behind the knee, and I can feel that for both on the right and left leg. So I'll go ahead and feel for those posts. So I'm feeling for those posts on my patient's legs, and they have a good both rate, rhythm, and force. There are no signs of those posts being diminished or unlabored. So I will state that there are no abnormal findings within my patient's posts. Next, I will go ahead and move on to the gastrointestinal and the urinary. So first, I will start off by inspecting my patient's abdomen. So I'm looking to see that my patient's abdomen, I'm looking to check for their contour and the symmetry of their abdomen. So as I'm looking at my patient's abdomen is flat. There are no signs of my patient's abdomen being distended, and I can palpate on my patient's abdomen. I would do but before I palpate, I always want to auscultate first. So I'm going to inspect. So I have inspected. I don't see any abnormal findings within my patient's abdomen. The patient's abdomen is flat, and the patient's abdomen is symmetric. So next, I'll go ahead and auscultate for my patient's bowel sounds. So I'll go ahead and show you those quadrants, and I'm auscultating with the diaphragm side. So I'll go ahead and place where I will listen for my patient's bowel sounds. So first we have we'll start off with the right lower quadrant. So we have the right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. And those are the placements that I would place when I am auscultating for my patient's bowel sounds. So we have, again, right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. And I'm listening again with those with the diaphragm side. And as I'm listening to my patient's bowel sounds, there are no signs of any abnormal findings upon auscultation. Next, I will go ahead and do a light palpation. And when I'm doing a light palpation of my patient's abdomen, I'm assessing for any signs of tenderness or any signs of distension. So with the light palpation, you don't want to press too hard, and I'm just going to assess in those same quadrants that I auscultated in. So I'll go ahead and do a light palpate in the right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. So after I have assessed that, I will note that there are no signs of tenderness or distension upon light palpation of my patient's bowel sounds. Not bowel sounds, of my patient's abdomen. Next, I will go ahead and move on to my patient's musculoskeletal system. And first, I will start off by inspecting minor and major upper and lower extremities. So first, as I'm looking at my patient, I'll go ahead and inspect the upper extremities. So one minor upper extremity that I can assess on my patient would be my patient's fingers. So I'm looking at my patient's fingers. I don't see any signs of, swelling in their fingers. There's no signs of deformities. They have, the skin color is even toned. Next, I will go ahead and the symmetry of my patient's fingers are normal. The contour, like I said, there are no signs of swelling or edema within their fingers, and they are bilateral on both hands of my patient's fingers. Next, I will go ahead and assess a major upper extremity, which would be my patient's shoulders. So as I'm looking at my patient's shoulders, I'm inspecting for symmetry, the contour, and bilateral. Both of my patient's shoulders are bilateral. They are symmetric to his body, and with the contour, they're flat. His shoulders, they might be a little broad. He's a man. But there are no signs of swelling or edema in my patient's shoulders. Next, I will go ahead and inspect the lower extremities. So as I'm looking at my patient's lower extremities, I can expect a minor lower extremity, which would be my patient's toes. So I'm also assessing for symmetry, contour, and that my patient's toes are bilateral. So I'm looking at my patient's toes. They're bilateral. They look symmetric.